Wes Streeting, there's a change of tone from the government this morning. David Cameron on Gaza is using the word ceasefire, which Keir Starmer's refused to use. Are you ready to change?
Well, that's not right. I mean, Keir Starmer used the word ceasefire early this week on Radio 4. He's used it previously. The question isn't whether any of us want a ceasefire. Of course people want to see a ceasefire and end to this bloody conflict. You look at the images coming out of Gaza, and not just in terms of the overall numbers, which are intolerable losses, but you look at the images coming out of Gaza, the children that are affected, the homes reduced to rubble. It is devastating and distressing. The question is, how do you get from where we are today to where we want to be? I think David Cameron talked about a sustainable ceasefire.
Yes.
And I think that's absolutely right. How do you get from here to there? We all united around the idea that we could achieve a humanitarian pause. That approach, I think, was vindicated to the extent that we got a humanitarian pause for about a week, aid in, people out of harm's way. But ultimately, even that agreement broke down. So I think we just got to keep in mind a ceasefire comes about when both parties to the conflict are able to negotiate a ceasefire. We've got to build a political path to that point and then beyond, because I think one of the most distressing things that's happened this week and concerning things that's happened this week was the Israeli ambassador to the United Kingdom arguing in very strident terms against the two-state solution.
Well, I think what she said was it's not realistic. I don't think she was particularly strident, but anyway.
Well, I'm afraid what we hear from senior politicians in the Israeli government is a one-state position. And that's not a sustainable solution for peace. The only solution is a two-state solution. That's always been Labour's position. It's always been Britain's position. And I think it is the only solution that will safeguard not just Israeli security, but the Palestinians' legitimate self-determination and right to statehood.
So you're broadly supportive of where Cameron's got to. Let's just talk about one other foreign affairs issue. The Prime Minister's been in Italy. Speaking at a conference, he says that without global action, Britain could be, his word, overwhelmed by illegal migrants. And that could destroy the public's faith in politics and destabilise our societies. You agree?
Well, I thought it was a stunning admission of failure. This is the guy who says, one of my priorities is to stop the boats. I'm doing a really great job. And then the next minute, he's off to Italy to say the quiet bit out loud to all of his right-wing chums from across Europe, which is he's failed. He's failed both to manage an immigration system that works for legal migration. He's failed to tackle illegal migration. And meanwhile, he's pulling his own party apart with this spectacular circus we saw this week over a policy that will not work and is costing us hundreds of millions of pounds already and threatens to offer us hundreds of millions of pounds more. The only flights that have taken off to Rwanda are the ones carrying Home Secretaries with hundreds of millions of pounds of taxpayers' cash with nothing in return. So we've got to get a grip on this. Labour's policy on this isn't as gimmicky as the government's, but it is practical and would help us to reduce illegal migration and have a much better managed legal migration system too.
All right, let's spend our time talking about what you might do were you to be elected, and your business is the National Health Service. Let's start with what you told Times last week. You said, I don't think it's good enough that the NHS uses every winter crisis and every challenge it faces as an excuse to ask for more money. Waiting lists at nearly 8 million, ambulances stacked up for hours outside A&E. Seriously, an excuse?
It's an astonishing record of failure from 13 years.
No. Let's deal with your words. Let's not get back onto how terrible Tories are.
I'll tell you.
You said, don't use this as an excuse. Seriously, are you calling that an excuse?
I think that when you look at the challenges facing the NHS, not just now but into the long term, we've got the triple whammy of a growing ageing society, rising chronic disease and rising cost pressures. And unless we keep a sharp focus on all three, we threaten to not just overwhelm the NHS in terms of demand, but bankrupt the NHS financially. And what I've been setting out is the case for both investment and reform, because pouring ever-increasing amounts of taxpayers' money into a broken system is wasteful in every sense. It's a waste of money we don't have, it's a waste of time that isn't on the NHS's side, and it's a waste of potential, because I believe from the bottom of my heart that the NHS as a public service, free at the point of use, can exist for the next 75 years. But we've got to modernise and change in order for it to be sustainable in the longer term.
Yeah, we've had this conversation before, but I really want to address what you've been saying. And, it's not a criticism. It's your words. You said also in that same interview you want to shake the NHS and the public out of complacency. We've been reporting on Sky News this week on the NHS. Can we have a camera there next time you tell a nurse who's come off a 12-hour shift that she's complacent?
Hey, I'm not saying that people working in the NHS are complacent. In fact, I'm amplifying their anxieties, their experiences at work.
Not.
And I see.
You're saying
hang on,
the
Trevor,
NHS
let me
is
finish.
complacent.
That's a ridiculous thing to say.
Your words.
I've sat in GP surgeries, literally looking over GPs' shoulders as they show me their outdated IT systems and the ridiculous amounts of red tape and accountability measures that they are subjected to, which waste their time that they would rather spend dealing with patients. I've spoken to those nurses and ward staff who are dealing with creaking bureaucracy and outdated systems that hold them back.
By complaining about the crisis. You didn't say that, did you?
I've been complaining about the NHS crisis. It's in its worst state in history, but I'm also saying, especially at a time when the public finances are in a total mess because of 13 years of Conservative mismanagement, that, firstly, there isn't a great deal of money to go around, and we can't be complacent about that. And I think there is a complacency that assumes that we can just turn the taps on.
When you say there is a complacency, put that in active terms. Who's being complacent?
Well, you only need to look at the reaction to what I said in the Sunday Times, that there are plenty of people who believe that the answer to the NHS crisis is simply more money.
Which people?
And look,
Which people?
Well, I mean, I'm surprised you haven't confronted with my social media mentions. They went into meltdown after the Sunday Times.
Come on.
But look,
who are you talking about? If what you want to say is, look, there are doctors or there are managers or what, say that.
Well, I think it's a general complacency. I think it's a general complacency about the NHS, its sustainability and its future. And what I've been setting out over the last 2 years as Shadow Health and Care Secretary are, yes, proposals for investment, fully costed and fully funded, but also linked to reform. For example, the 2 million more appointments that we would deliver at evenings and weekends to cut the backlog. Yes, more appointments, but also the NHS working more efficiently and effectively, as they did at Guy's and St Thomas's. That was on the front page of the Times this week, but we need to see that sort of approach everywhere. When I talk about mental health support in every school and community mental health hubs in every community, a fully costed, fully funded policy. Yes, that's about additional investment for new services, but it's also reducing demand on general practice and keeping people out of A&E. So there will be investment with Labour, but it's got to be linked to reform. And I am worried about the complacency that against the backdrop of appalling public finances, people assume that an incoming Labour government will just be able to turn the taps on. Even if Rachel Reeves had a complete personality transplant and became a big spending chancellor, she might turn the tap on, but there'd be nothing in the tank. So we've got to be honest about the fact the public finances are in a mess. We've got to get a grip on that. That's why Labour's priority is going for growth. But the answer to the NHS isn't just more money, it's investment and reform that delivers results.
Well, let's talk about the kind of reforms that you might have in mind. You recently visited a high-performing hospital in Singapore. You said you want our hospitals to be more like that, with advanced technology, patient-centred approach, all that. 2/3 of healthcare spending in Singapore is private money. That's even more private sector involvement than in the United States. If you're in Singapore, there are 5 classes of care. You can buy better room and so on, A, B, C and so on. Is that what you want the NHS to become?
No, I'm fully committed to the NHS as a public service, free at the point of use. And whether it's Singapore, Australia, where I was recently, continental Europe, I don't think the problem with the NHS in our country is that it's free at the point of use and publicly funded. It's not the model of funding that's a problem, it's where the money goes. Because when you compare the NHS to other OECD countries, we're pretty much top of the charts in terms of hospital spending, but when it comes to primary care, community services, mental health, diagnostics, we're either near the bottom, at the bottom, or seriously
our
lagging
money,
behind.
we've got enough money, but we're spending it in the wrong places.
In the wrong places. So, for example, there are now 2,000 fewer GPs. Those smaller number of GPs are providing 1 million more appointments than they were before the pandemic, but people still struggle to get a GP appointment. So instead of going to see a GP which costs the NHS 40 quid, they often end up in A&E which costs £400. So that's why I say to the NHS, and make the case to the public about Labour's reform agenda, it's not just about more money, it's about where the money goes to get better outcomes for patients and better value for taxpayers' money.
Well, one way that they get better value in Singapore is low-paid labour. A third of the Singapore workforce consists of low-paid Chinese, Filipino and Malaysian immigrant workers. The equivalent here would be to have 25 million immigrant workers. Now, your party wants a number of immigrants down and pay up. How are you going to square that circle? If you want to copy any part of that model, you're going to have to do something like that.
Well, we have an over-reliance on overseas workers working in our health and care system, and that's challenging for two reasons. One is we've got a global shortage of health and care workers, so we can't assume that that pool of talent will always be there to draw from. And secondly, the UK is recruiting from red list countries, countries identified by the World Health Organization as having a serious shortfall of their own. So I think that's immoral. We've got to invest in training our own homegrown talent. That's why we're committed to double the number of medical school places, so we're not turning away thousands of straight A students, but we've also got to improve the pay of care workers so we can recruit and retain those brilliant care professionals who are crucial for the future of meeting the challenges of growing ageing society, rising chronic disease and rising cost pressures.
One last question, which is not about health service, not even really political. On the scale of 1 to 10, 10 being utter devastation, how disappointed are you that Tony Blair says he won't do a David Cameron and come back into government?
Look, unlike David Cameron, Tony Blair doesn't have to return to government to try and rebuild his reputation. David Cameron, I think, had a disastrous legacy as Prime Minister.
Oh, come on.
And
wouldn't it be good to have Tony back round the cabinet table? He's your kind of guy in the Labour Party.
We can call on Tony's advice any time we like, and we often do, but it's no surprise to any of us that he doesn't fancy returning to the House of Lords and returning to Parliament.
Wes Streeting, thank you very much indeed.
Thank you.